So why would my patient benefit from nutritional counseling? So nutritional counseling would benefit the patient due to her increased risk of developing type 2 diabetes, heart disease, and her proneness to developing caries. My patient did report Hispanic ethnicity, so traditionally her culture eats scheduled meals and they are usually full meals at each time. They're high in protein, grains, and carbohydrates. She does have vegetables included in that, fruits, and then sweets are usually eaten as snacks. Her economic factors include that she does live in a large household and her grocery shopping is usually bought in large quantities so that they can feed more in her family. She also, I feel like this did influence her because she does eat scheduled meals and they're usually high in calories. It's also multiple times a day, and then sometimes she doesn't eat because she's waiting to actually have like that full meal. So she doesn't eat like healthy snacks in between those those meal sessions. So just for her caries risk assessment, we're going to go into she does have fluoridated exposure. She does consume sugary foods or drinks primarily at meal times. She does have carious lesions within the last 6 months. Her dental home, she does have a dental home. There were no special health care needs, chemo radiation therapy, eating disorders, medications that reduce her salivary flow, or drug alcohol abuse. And also, she did have 1 to 2 new carious lesions within the last 36 months. Teeth missing, no. Visible plaque, yes. She didn't have any unusual tooth morphology. And also, she did have pretty large interproximal restorations. Exposed root surfaces, no. There were no. She did have a slight overhang and then an open margin on her crown. She didn't wear any orthodontic appliances anymore, and she didn't have any severe dry mouth. So she was at a overall high risk for dental caries. So my suggestions would just be to instruct my patient to have routine dental visits to prevent the progression of periodontal disease and dental cavities. Avoid high consumption of carbohydrates and sugars. Brush 2 times a day with a soft bristle toothbrush for 2 minutes. Floss 1 time a day and use fluoridated mouth rinse for 30 seconds without rinsing after. So for her diet history on her food diary, she just click on that. You can see on her day 1, she had some oatmeal. So basically what I determined was she was pretty thorough with her information. She did miss a few things, like she didn't include how much peanut butter and what kind of bread it was. And so anything in the blue is what I asked her and what I clarified. So sometimes she didn't put that she didn't consume any snacks. And you can see that she has pretty big meals and then doesn't eat anything like on the next meal. She doesn't eat out a lot. It's usually mostly homemade foods, and anything in the yellow is what I highlighted as a fermentable carbohydrate. She does have pretty adequate intake of water, and as you can see, she did not exercise any of those 3 consecutive days.